Hello everyone, my name is Danish. Welcome to this YouTube video. This is a project that I've been wanting to work on since quite a long time. So the name of this project is Foundations of Clinical Medicine, Thinking Like a Physician. So this is going to be a 13-week course which is going to help basically undergraduate students, right, who have just started medical school, get into the know-hows and some of the interesting aspects of clinical medicine, right. Let us begin. So why does this exist? I'm sorry for the glitch. I don't know if you saw the glitch there. Why does this exist? Why does this course exist, right? So it exists to serve a purpose. It exists to fill a gap which I have felt severely in. I felt severely in my career, in when I was starting to, work as a doctor. In the starting months of my internship, I felt that my years of education in med school had left me in a position where I knew things in a way which allowed me to claim that I was knowledgeable, but that knowledge was very difficult to connect. To connect, what I want to say is, it was so difficult to connect that knowledge with the things happening around me, right, in the starting of the internship. And this course in a way is trying to help and solve that problem for the me that existed back then. So, question: why do even the good students freeze at the bedside? And by saying this, I don't mean that I'm a good student. I was an average student at best. But even when there were, like, I've seen very good students, right, who were so knowledgeable, they would get all straight A's in their class. They would be doing the best presentations. They would be doing such good stuff, right. uh, they when they were at the bedside, when they were beside the patient, it was for everyone just a brand new experience, right. Now the thing is, why is that? Why is even the students have done very well? Why is that they too suffer, this kind of a thing at the bedside? So what we learn in class versus what we face in wards, there's a huge difference between what we learn and what is expected out of us, right. For example, in the class you might learn about the causes of dyspnea, whereas when you go to the ward, you will find a patient, a real life human person in front of you who's gasping for air. For example, you might learn about the types of anemia in a class, but when you go to a ward, you might be shown a lab report, a complete blood picture, a CBP or a CBC, a complete blood count, where a patient comes with an MCV, mean corpuscular value of 68, with pallor and fatigue. What do you do with that, right? And for example, you might learn about the cardiac output, which equals heart rate into systemic volume. But in the ward, you would find a patient who's in shock, and the question is, what do we do first? And now I just want to make it clear that all of these things on the right hand side of the table, right, you will get to know about them in the final years of your medical school, right. But I think that if at the start of the entire course, if there are chances given to students to get through these things in a way which is easy and understandable, they are more than likely to be interested in what they're learning, right, because it gives them an understanding that what they're learning is not for vain, that they're going to one day use that knowledge to help a real person in front of them. And I'm hoping by this course I'm able to do that. So the gap is that between knowledge and reasoning and action, there is a lot of gap, right. So the goal of this course is to close that gap. Now, the current gap is that students often learn theory without bedside reasoning. What the need is in the current atmosphere of the medical education that I've felt myself when I was going through internship is that there's a lot of distance between preclinical sciences, right. Once you get into the clinical part, a lot of the things you will be able to make connections and stuff, but in the preclinical branches it's going to be difficult. So what we need to do is we need to bridge preclinical sciences like physio, pathology and pharmacology with clinical decision making, right. The goal of this entire course is to strengthen reasoning, confidence and curiosity in real patient settings, right. And so I'm still an intern as I'm doing this course, and this entire series is actually, if things go right, supposed to run in parallel in real life, in the hospital that I'm working at. So this series will be based, you know, it's going to be an intern-led thing. It's going to be collaborative, and you know, as you're seeing this on YouTube, if you want to enroll into this course, you know, I don't know about certifications and stuff as of now, but you know, I'm going to provide my email ID at the end, or you could just, you know, write in the comment written that we are in a class, and you know, you can participate, because this is going to be collaborative. This the collaborative course. This is not going to be a didactic course, right? So yeah, at any time, you know, you want to contact me, you have my email ID, you can write to me. So the thing is, any other person could teach you this course, right? Or not teach particularly, but you know, introduce you to this course and share the course material. But why is that I am the one who's doing this? It's because I struggled with this gap myself, right? So, as an FMJ intern, and you might wonder what is FMJ? FMJ is foreign medical graduate, because you know, I did my medical education in Ukraine. I came back to India. I wrote the licensure exam. I passed through and got into the Indian medical system here. As an FMJ intern, I saw that our biggest challenge isn't knowledge; it's connection, right? You might know endless facts, but you don't know how they fit together. You might be able to recall them, but you know, you might not be able to use them, right? So this course was born out of that struggle and the mission to make reasoning accessible. So here, I'm not exactly a teacher, you know, there's so much that I need to learn, there's so much that I need to grow at, but I believe, you know, that is true for everyone. So about me, my name is Dr. Mohammed Abdul Danish. I completed my MBBS, although it's called as an MD in medicine, you know, in the university I did, which is the Uzhhorod National University. It's in the west side of Ukraine. It's a beautiful place, you know, the city that I did my undergraduate in. I'm an FMG intern. Currently, I'm working at the Government General Hospital, Narayanpet. I'm an author, educator, and a mentor. Here are a couple of the books that I've written. One of them is Navigating Rheumatoid Arthritis. I'm really interested in rheumatology, so you know, I had to do that. And I wrote a couple of books as a guide for Krok. Krok is basically the Ukrainian word for step. You know, in Ukraine, you basically have to pass 2 steps, step 1, step 2, to get your licensure, to get your degree. And this was the exam that the second part of the exam I wrote a couple of guides for, which were very successful. In fact, you know, some of them are still used by the students there, and even to this day I get emails, you know, people thanking me that, you know, thank you for the book and stuff. And then there is like the short guide to lab and ECG and X-ray interpretation, and a short review of medicine and surgery. So other than that, beyond the boards, what have I done? What are the books that I've done? So as I said, in medical education, I've authored 5+ books. I'm running this YouTube channel which you're seeing, and in terms of the exposure that I've got, I've worked as a clinical intern at Interfamily Clinic, which is in Uzhhorod, where we had a multinational team, you know, people from different countries, different continents even. And I also worked at the Red Cross in Uzhhorod, where, you know, we were helping war refugees. In terms of mentorship and volunteering, I've been working with this foundation called Engine, where I've been a volunteer. There, I particularly teach English and communication skills, right? For the last 3 years, I've trained more than a dozen students one-on-one to help them achieve their goals. I also have certifications in data analysis, digital marketing, and inbound education. So, with this course, what is my vision? My vision is to help undergraduates think, interpret, and act like doctors in training. What does this mean? You know, there is a huge issue with our current education system. It's that, you know, you do 5 to 6 years of education, and then you go out into the world, and you're introduced as an intern, and not in a way that, you know, this guy is here to learn. It's that, you know, this guy doesn't know anything, right? The term intern right now carries a lot of negative notion, and it's such a stupid thing to say to someone who's studied 5 to 6 years, right? And I'm not going to say that, you know, people who have studied more shouldn't be respected. Of course they should be respected, but what I mean is that, you know, you like trying to use the understandings that I've developed in my past year at the hospital that I was at. I'm trying to build this course so that the undergraduates have a chance to understand the very basics of the things, right? In this course, we are not going to go very deep into so many things, right? What I'm hoping to do is to give you a bigger picture about everything internal medicine related, general medicine related. Of course, I cannot teach you everything because I don't know everything. But the thing is that I want to make it so that once you go on to a ward, you should not be clueless, right? And that is the assumption that we are going to work with. We are going to work with the assumption that you don't know anything, because I feel that if we build it from the ground up, it's going to help us understand things in a lot better of a manner. Because if we assume that you don't know anything, you'll start to question even your most basic assumptions, right? And if that happens, you're going to learn things in a very different manner than you have. So what is the philosophy? The philosophy in this course is going to be that we are going to build a mindset plus reasoning, and we are not just going to act on recall. What this means is that uh, people have a good ability to recall things. You can recall something that had happened 10 years ago, but the thing is, just remembering something has happened is not going to help you. How does that fit into your current life? So that kind of a mindset where everything that happens to you in medicine, you try to use it towards becoming a better doctor, right? That is what we are here to do. We are here to teach how doctors think, not just what they know. And how are we going to do this? We are going to integrate pathophysiology with investigation and management, and we are going to finally reflect on the process. So this is going to be a 13-week course, as I said, right? Oh, it's glitching again. So by the end of the 13 weeks, participants will be able to do the following, right? Systematically approach any OPD, which is an outpatient department ward, OPD case or ward case, interpret core labs like CBC, LFT, RFT, ECG, chest X-ray with reasoning. They will be able to connect physiology to pathology, and from that, get to some pharmacology and see how that helps the patient. And finally, they will be able to demonstrate professional communication and empathy, right? Because what happens is that when you are going to work in a system with other doctors, right, doctors who are going to be seniors, and you're going to have juniors as well, you need to have an ability to communicate things effectively, right? And the final idea is that we will be able to we are going to learn how to reflect on decisions and build a lifelong clinical curiosity. Because that's the thing, right? You might learn something today, and maybe a couple of years from now that thing is going to be totally proven to be wrong. What are you going to do then? Are you going to stick with what you have learned, or are you going to stick with what is new and what is improved, right? So this is going to be the structure of the course. The structure of the course is going to be this way. So we are currently in the phase 0. Congratulations, you're almost done with it. It's going to be a small phase where we are going to have orientation, introductions, and a baseline quiz. I have not prepared the baseline quiz yet, because I'm hoping to prepare it once the course is finalized with the hospital people that I'm working with. Of course, by the time you see this video, you can just go to the comments and check if the baseline quiz is available. If it's available, you can do it. If not, you could just type down a comment, and I'll get to it. Then we'll go to phase 1. Phase 1 it will be for 3 weeks, where we will develop the mindset and clinical thinking foundations, right? And then we move on to the second phase, where we will be working from week 4 to week 10, where we will be going through organ-based integration, right? Where we'll have a medicine and surgery overlap. In phase 3, we will have psychiatry, reflection, some little bit of ops and gynae things here and there, and then a bit of ethics and professionalism and how to work through. And so the total course is going to be 13 weeks. So how are these courses going to be? There's going to be like a couple of things, right? Firstly, we're gonna have the main item at the dinner is going to be interactive lectures. So what we're going to do is we're going to have 60 to 90 minute sessions using clinical vignettes. They're going to be primarily going to get to the root of the things that we are going to talk about, such that you don't have to question yourself again while you are going to use that piece of information, right? You'll get to understand what I mean. For example, imagine that we are talking about let me give you a question, right? What electrolyte imbalances are going to be the most common ones after a blood transfusion, right? So the answer would be, you could have hyperkalemia followed by hypokalemia, and then followed by hypocalcemia. So why are these going to happen? So we are not only going to look at how the electrons. So why does this happen? We are not only going to look at how the electrolytes work in this situation, why do they get reduced, but we're going to go back to the reasoning of why are they there in the first place, right? Why do we, as multicellular beings, have more sodium inside our cells and more potassium outside the cell? Why is this not the other way around? And the sessions are going to be interactive. Now if you're going to watch this on YouTube, you can leave comments. I'm sorry, that the thing is that we just don't have enough audience to have interactive lectures online, but you can leave comments and get back to it. And that is how we are going to do this, right? I'm going to give you some blueprints, I'm going to give you some roadmaps, I'm going to give you some cheat sheets, which will help you. And then if you see this video or something, right, and if you want to submit a presentation, you can, but in real life how it's going to be is that we're going to select students either randomly, or if they volunteer it's good, otherwise randomly, to do peer presentations where they're going to do a 10 to 15 minute speech over the thing that we're going to talk about. And then we're going to have office hours. So these office hours, obviously in real life they're going to be much simpler. In online, if you are if you see this video and you want office hours, you can just comment, and we can set this time and schedule, and we can have a chat if you need anything, if you have questions or something. And then you're going to be left with reflection tasks, right? These are going to be things that I'm going to leave you with, that things that you can think about until the next session. So example topics, right? For example, this is about the organ system based thing that I told you about earlier. This is going to be very high yield system based reasoning. For example, in cardiovascular system we can talk about chest pain, syncope, and ECG logic. In respiratory system we can talk about dyspnea, hemoptysis, pneumonia. In gastrohepatic system we are going to be talking about jaundice, GI bleed. And in renal system we are going to be talking about edema, oliguria, electrolytes. In endocrine system we can talk about thyroid, diabetes, and adrenal logic. In infectious diseases we're going to talk about fever, sepsis, and antibiotics. As I said, it's going this is supposed to be a participation model. Obviously, online it's not going to be that easy, but we'll figure out something. So how it's going to happen is that we are going to have students who will rotate every presentation, or who will give a presentation every week, and there's going to be group case reflections to help boost confidence. What is going to be the evaluation? At the end, you're not going to get any marks or points, because once we start to quantify it, it might get a bit dull, right? I mean, there are studies that quantification does help, but for this course, maybe right now, no. What you're going to get is mentorship and growth, and then as a final, you're going to get a case, or you can submit a case where you include all the things that you've studied from this course and how it has helped you, right? And for anything during these 13 weeks, if you need any feedback or anything, I'm always here. You can reach out to me. What are the expected outcomes, right? The expected outcomes in this course are going to be improved clinical reasoning among students, stronger bridge between preclinical and clinical years, to promote a culture of self-learning and collaboration, to create replicable teaching models for other institutions. So you might be wondering, why should we do it now? So why now, why here? Because clinical thinking cannot wait until post-graduation. It starts now, here in the undergraduate years, through the guided discussions, reasoning, practice, and reflection. So this hospital, wherever you work at, has the patients, the cases, and the opportunity. This program brings the framework, a structure to help students learn how to think like clinicians. Right. So this is the closing statement. The aim is to not teach medicine, but to teach how to think like a physician. I'm Dr. Danish, and this is my email ID, madanish.official@gmail.com. And it was so lovely to talk to you. I hope you guys have a good day. Before that, I want to meet you. Let's meet the future clinicians. I would like to know what's your name, what is your year of education, study, internship, and why did you join this course, and one clinical thing you're most curious about. And you can tell me a fun fact or interest about yourself. Of course, if you're not comfortable with writing it in the comments, you can email me. I'm going to leave my email in the comments. Okay, so that's all. Thank you so much, guys.